Asthma and COPD are one of the most common diagnoses that a physician makes in clinical practice. In one of the biggest studies ever conducted in India, called as the Poseidon study, where 13,000 doctors across 880 cities and towns kept a record of every single patient that they saw in their clinic on that one particular day. A total of 205,000 patients' data was gathered on that particular day, which gave us a tremendous insight into what are the reasons for which a patient visits a doctor in India. Expressed as an alluvial diagram, you can see in this slide, just like the layers of the soil, the heaviest layer settles at the bottom. And you can see that the respiratory component is the heaviest layer across all the age ranges, right from 0 till more than 60 years of age. The second, as you can see, is digestive in the pediatric population, and then as you become older, it becomes less and less important. The circulatory system becomes more important as you age, and so on. So this is a tremendous graph that gives you an insight into what do people suffer across different age ranges. And across all age ranges, it is respiratory that is the most common disease for which a patient visits a doctor. The three most common diagnoses that a general physician makes in clinical practice is hypertension, diabetes, and obstructive airway diseases that include asthma and COPD. The global burden of disease is the latest and the most authentic source of information about the burden of asthma and COPD in our country. Published just a couple of years ago, it gives us an insight into how common is asthma and COPD across different states in our country. This slide over here depicts the change in the prevalence of COPD from 1990 to 2016 using a heat map or a heat color code. And you can see that almost all the states in India seem to have shown a significant increase in the prevalence of COPD. On the extreme right hand side, you see a cartoon with different dots, and you can see that the dots for asthma are very close to each other, suggesting that the prevalence of asthma is not very different from the different states in India. But for COPD, the prevalence varies widely from one state to the other, and that is important for us to appreciate. An estimated 55 million people in India suffer with COPD, and about 38 million people suffer with asthma. So a total of 93 million people in India suffer with asthma and COPD. Both these diseases in India are one of the topmost causes of suffering and death. Sadly, 40% of all the asthma deaths that occur in the world occur in India. And that is something that we need to start worrying about, because that clearly suggests that as physicians, we are not doing a good job when it comes to asthma management. On the other hand, COPD causes more deaths than all the other diseases combined together, such as AIDS, HIV, tuberculosis, malaria, and diabetes, all put together. That is how important is COPD from a national perspective in terms of an important cause for causing death. If you look at the burden of COPD in different countries across a period of time, you can see that China was the country that had the most number of cases of COPD, but India has overtaken China the last few years, and now we are the country that have the most number of cases of COPD in the world. China is now number 2, followed by USA and Brazil, and then Indonesia. When it comes to asthma burden, there are more asthmatics in China than there are in India. But you can see that the line for the slope for asthma in India seems to be going upwards. And I wouldn't be surprised if India overtakes China for the number of asthma cases in the next couple of years. When you look at the number of asthma deaths, for COPD deaths, India is clearly one of the leading countries in the world that has overtaken China as well in terms of the number of deaths due to COPD. For asthma deaths, there is absolutely no competition. About 40% of all the global asthma deaths occur in India, and that's a very shameful slide for me to show you. The risk factors that are associated with COPD are varied. varies from state to state. And you can see here the disability adjusted life years or the suffering and the deaths that are associated with COPD vary widely from state to state. Uttar Pradesh is the state that has got the highest suffering and death due to COPD, and then Goa, right on the top, has perhaps the lowest prevalence of asthma and COPD in our country. But clearly, asthma and COPD are big and growing problems in our country, and as physicians, we need to be aware of it, and we need to make sure that we diagnose and treat them better so that we can reduce the burden, the suffering, and the deaths that are associated with these two common diseases. Thank you.